I hope you saved this video for last. I hope you did all the other work and you trusted me and you did everything else and saved this video for last. And I know it's dark. I can see the shadow, but I need a little extra darkness for this video because I'm going to use the ultrasound. And when we talk about PiCC Nurse Boot Camp and you getting that first stick, and when we talk about everything you have to do as a PiCC nurse, it all comes down to this right here. I mean, the drive time, the paperwork, the setup, the prep, the tear down, the go home, all of that is about what's happening right here. And this is just a little block of tofu with a straw in it. It doesn't require much, a little bit of gel. There's the vein right there. See the vein? There's the vein. But before we even do that, I want to show you something. This is the 21 gauge needle. I want you to see what it takes. I've got bevel up. I've got the angle of the probe, and I want you to see, okay, what just happened? First thing you have to understand is that's the tip of the needle. But once the tip of the needle passes, the shaft up the needle is still underneath the ray. So if you've got the bright spot comes into view and it sort of stays there, but you've moved past it, you have to move your probe to match. You've got to be able to see tracking the white, tracking the white, tracking it. Right there, there's your reflection. Got to keep the probe perpendicular. Got to get as much there. There it is. That's it. See me wiggling it? See me moving it? See me pushing past? And here it is again, me finding it again. Okay. That's it, my man. That's it. Now, when I say this is nothing and yet it's everything, that's what you're looking for. See that white dot? This is the 20 gauge. Again, bevel up. I'm going to find it with my probe. That's the 20 gauge. It's a little bigger. I should be able to get them pretty close together. Let's find the tip, follow the, see, there it is right there. And I'm going to, that's the 20 gauge. It is definitely brighter. Those are the two gauges. There's the 20 gauge right below it. See it? That's the 20 gauge. That's the 20 gauge. That's what you've been waiting for. Yay. There it is, right there. And when you come to PiCC Nurse Boot Camp and we sit over this little piece of tofu, does it feel ridiculous? Hell yeah. But you have to be able to hit that needle with your needle. Boom. Hit one needle with the other needle, because you're going to have to go in between. Ooh, I moved them both. I knocked it. There you go. You have to be able to go between an artery and next to it, right? You have to be able to thread. You just have to be able to get right in there and touch it. So I'm pushing it away. There's a difference between the 20 and 21 gauge needles, but the idea is that's the goal, what we're looking for, okay? So let's take 21 gauge needle. Let's go back up to the straw. There's the straw. I know I've got to kind of get right under the probe. See my needle show up under the probe? See my needle show up under the probe? I can push on the vein. That's me pushing on the vein. You can see me wiggling. And if I want, I can't poke into the vein. And now I've got to find, okay, so there's, now I've got to find my needle. I've got to get it back under the probe, into the vein, and under the probe. It is a little, I'm laying it up. Ooh. You can pull back and move it forward as long as there's the bottom. And that's me pushing on it right there. It's in tofu, that's me pushing on it. Okay. I'm in the vein. At this point, we're talking about advancing the guide wire. So when you're worried about your first stick, I just want to point out that you're about to learn how to drop your sharp, how to make an incision along the guide wire. I mean, there's your loop. I'm making it a little big because it's in the straw. And then follow your guide wire right in, because you know it's in the vein, right? I can see it hanging out the other side of my Wendy's straw. The introducer's always it's always a thing to get an introducer into the straw. Introducer in, grab my wire, and I'll tell you, sometimes it goes just like that. Pull my wire back till it's almost right there, pull my vessel dilator back out a little bit. That gives me time to get prepped for my midline. Pull the end of the wire, get ready for the swap. Remember the swap video? Pull the vessel dilator, swap in my midline or my PiCC, and there you have it. There is your procedure, right down to using the equipment, getting a little subcutaneous, putting the vessel dilator in. I mean, all the way you could pop it right now and try to keep that tofu in shape, intact. Coming here, using the equipment, walking up to the patient, pulling the bed out, getting it set up just like you've been watching me do. If you have waited till this is the last video, that's how small of a thing it is, and I was in. Is it sometimes more difficult? Yes. Is it sometimes just that easy? Yes. And you are in and out with your money. Bam! Thank you. And patient care. That block of tofu right there, and setting it up and getting the vessel dilator through there and holding it and moving. I mean, I can put a block of tofu on Richard's sample if that's what it takes, or we sit here and use the equipment and you do it. And I'm telling you, if you get, I did 200 sticks before I did this. And once you find the relationship between the bevel and where you have to be right under it, once you and I just visualize it working here, once you and I just visualize where the middle is, where that ray is, and how you move past it, and I'm advancing the needle past it, and now once you have that motion, once you stick that straw and cut through it, it is 2 minutes out of the whole 90 minutes. You're a PiCC nurse. PiCCNurseBootcamp.com. Do that. Go and do the whole thing, because this is, if you got everything else in your procedure right, they would be so happy. Any company would be so happy to have you. If you could get through the setup and the paperwork, and even if they had to watch you 3 or 4 times to do this part, They would be so happy to have you at that skill level. And after all the videos that you've watched, and after all the made fun of going to school for 2 days and showing up late and leaving early and a 2-hour lunch, for all those jokes, all they had to do was this in class. And you would have paid for another week. When you come to PiCNurseBootCamp.com, you're going to do this. You're going to do everything else too. Approach the patient, finish. You're going to do the paperwork. I'm going to give you a face sheet. You're going to do all of it. But this is what everybody asks you. How many sticks do you have? And that comes down to finding the tip of the needle, 20 gauge, 21 gauge, the angle of the probe. That is exactly what it comes down to. And it was 2 minutes out of the whole thing. That's what you're paid for right there. PiCNurseBootCamp.com.